When you're reading, do you read the words out loud in your head, each word, as you're reading?
Like the entire word?
Yeah.
itself?
And you can hear it in your head as you're reading.
When I read, I hear every word.
Okay.
Well, okay, let me say this. I think it depends on how I'm reading.
Mm-hmm.
If I'm reading like really intentional and like I really want to grasp the concept really well, then yeah, every time it's every word. But there are some books that I'm like, cool, I can understand the concept, and I'll scan. And then I'll scan through, and then I'm not obviously not reading individual words then, and then I'm getting big pictures. I'm just reading like quick sentences.
See, we talked about this earlier, right?
Well, Jacob, what's yours?
I don't understand the question because, like, when I read, like, this is a book, right? On the back. It says, a small amount of clarity can change your life in huge ways.
That's beautiful.
That was beautiful.
Yeah, I'm
Wow.
crying. You can't see me. I'm crying.
But when I'm reading that, in my head, I have to sound out the word, like, a small clear, like in my head, like, or I can't read. I just look at words. Like, you have to say the word, right?
Let me see it real quick. Let me see.
Like, a small amount of clarity can change your life in huge ways. Like, in my head, I'm like, you can read it.
You're saying each word.
Yeah. Otherwise, what are you gonna do?
I don't.
Like, what do you do when you see the word clarity? Do you say clarity, like in your head? Does it say clarity, or do you just look at it? What?
I don't know. It's not. I don't say each word in my head when I'm reading.
So you use a blank slate?
Not quite. It's like somewhere in between. Like I know what I'm reading. I could say it back to you, but when I'm reading, I'm not saying a small amount of clarity can change. I'm like not reading each individual word in my head out loud.
Well, it's quicker than that though.
Yeah. It's hard to say it as fast as your head does it.
Right. You know what I've heard also is that if you listen to a book and read it at the same time, you're supposed to comprehend it better and be able to read faster because you're supposed to speed up the audio book to whatever your brain, the speed your brain goes, right? And then you're supposed to be able to read it a lot faster and comprehend it.
That's actually what I wanted to do with the Principles book from Ray Dalio because it's a huge book.
That's a wordy book.
I have it on audio, and I've listened to part of it on audio, part of it reading itself, and I'm like, I should just combine this. I have both mediums.
That's a wordy guy.
I'm going to try it. I like his words. I like his
YouTube videos.
How did that come up?
Oh, okay. So supposedly, if you say the words out loud in your head, you're a slower reader than people who read without saying the words. And I can't remember. It came up with...
Is that why you call me slow?
That's the only reason.
Yeah, I don't know how to read other than to literally say
each word.
I have to register the word in my brain. I don't like mouth the word.
Yeah.
But
you also consider yourself a slower reader. I consider myself a fast reader.
Yeah, you've also read many more books than I have. I'm like a two-hand book guy, you know?
Yeah.
You read with two hands?
Yeah.
Yeah.
I have a stand, so I have no hands.
Okay.
Yeah.
Yeah.
Sometimes I like to be fancy and read with one hand.
Yeah,
you know?
That's incredible.
And then flip the page with the other, you know?
Wow.
I have my son Noah flip the page for me.
Oh, okay. Yeah.
Do you consider yourself a fast or slow reader, Daniel?
Slow reader. Well, I wouldn't say slow. I think medium. Can I say medium?
Yeah, you can say
slow makes me sound dumb, and I just don't want to sound dumb.
Yeah, so it is slow, but you want to say medium.
It's not fast. I know it's not fast.
Yeah.
Not fast.
Well, so far it checks out. Everyone who says they say the words in their head self-prescribes himself a slower reader.
I feel like slower reader sounds like I don't know words, so I'm trying to figure out words, right? Where I know the words. It just takes me a little longer
You know
to read
what,
them
though?
than you, probably.
I would be curious who has better comprehension. Maybe you guys have better comprehension because you slow down more.
Probably not.
Welcome to the Nomadicare Show, episode 4. This episode is all about insurance. So if you're wondering if you should get your health insurance through your staffing agency, on your own, or through the government marketplace, this is the episode for you. We go deep into all the pros and cons of each one of those.
Super common question we get all the time. And just to paint the picture for people, at Nomadicare, at least, we track all this data, right? And about 60% of our travelers take insurance through an agency, and about 40% of our travelers take it on their own. So can't wait to kind of dig into this week's episode to figure out what should you do.
Okay, sounds good. If you're listening on a podcast, please follow us. And if it's a YouTube, subscribe and leave comments. Let's get into the episode.
1, 2, 1, 2, 3.
All right. First question comes from Anonymous. great name, from one of our Facebook groups, and they ask, what does everyone do for health insurance? Do you go through a third party? If so, which one? Or do you just use the insurance your travel company provides?
Sweet. Great first question. This is something I think every single traveler cares about and wonders about.
Super, super common question.
Yeah. Okay, so big picture, the reason health insurance is a common question in travel healthcare specifically is because as travel healthcare workers, we work 13-week assignments at a time, give or take. And then in between those assignments, you might take time off to backpack Bali. You might go visit your friends and family. You might not have another job lined up that starts the week after. And in that, we have gaps in our employment. That's the nature of this industry. And in those gaps, we want to make sure we have coverage that is good coverage rather than just crossing our fingers that the time in between our assignments isn't when we randomly need our health insurance for some reason. So it's a big fear. And I remember me as a traveler, I've done a little bit of everything. I've taken the company insurance. I've crossed my fingers during the time off and, it worked out for me, which doesn't mean it's the way to go, but I did that whole, I'm invincible in my young 20s mentality thing for some of it. And then I had my own insurance for a big chunk of it towards the end.
Yeah, and it's both, right, gaps in coverage and switching employers because travelers will switch staffing agencies because staffing agencies have different jobs or you may vibe better with a different recruiter or a different company, whatever the case is. So there's multiple reasons why you would have to move insurance or
totally. And that's a really
insurance.
smart thing to do as a travel healthcare worker. You want to work with multiple companies. You want to hear about the jobs that each agency has, and you want the flexibility to just switch without suddenly having like new insurance or the worst case, no insurance for a while. So I think the biggest problem that we got to make sure is solved is how do you make sure you have coverage the whole time you're a travel healthcare worker?
Yeah.
The thing I think that people don't maybe know is you can do that with both of them. There is a way to make sure you're covered the whole time if you take company insurance. And there is, of course, a way to do it if you have your own, because that's when you have no gaps at all. And you know exactly what your coverage is covering. It doesn't change throughout the year either. So I'll actually start with the company insurance side of it to just talk about maybe the pros or why you might take that one. One, the company insurance is typically cheaper while you're working because most staffing agencies will cover some portion of your health insurance.
Totally.
And so with that, you are paying for part of health insurance, not the whole thing as you would be if you had your own. So check, it's probably cheaper. Sometimes it's better health coverage. This totally depends on the staffing agency. So when you're trying to figure out which staffing agencies to put in your team of 3 or 4 staffing agencies that are your go-to, that might be something you ask them early on, not just when you get the job, but right when you're talking to them, especially if you have healthcare needs. You have a prescription, you go to the doctor X, Y, and Z times, stuff like that, because every plan should cover emergency situations and stuff like that. So you might ask them. But if they have a good plan, they're a company that can get one of those higher tier, you might have better health insurance coverage with the staffing agency than your own. But that's not always the case. Sometimes it's the flip. So you got to look at that. Kind of side note there, bigger companies have what's called economy of scale. They have a ton of employees, and the health insurance companies love that. So they have access to things like Blue Cross Blue Shield, where those insurance companies will not even allow a small staffing agency to get in the door. They cannot use that. So they kind of have to find other health insurance until they get big enough. And then the bigger companies also pay less. They're like, great, you're giving us 500 or 1,000 travelers at a time. We will, because of the scale, how many people you're giving us, we will give you a lower cost.
Yeah.
And the smaller staffing agencies have to pay more for sometimes worse coverage.
Yeah.
So, and it's not always the case. So look at it. One of the worst things we can do, I think, is just assume. Be like, you're a small company, you probably have crappy insurance, or you're a big company, you probably have great insurance. Look, but there is truth to the cost of that. And when I was a traveler, the one thing I looked at the most on the plans that I cared about the most is how much would it cost me to go to an urgent care, not ER, because I didn't expect to go to ER, but typically we don't have like a doctor when we're traveling, like we don't have like our primary care provider.
Yeah.
So if you're sick and you need something, you typically go to those walk-in urgent care clinics to get medicine, to get checked out, to see if you have strep throat, whatever it is. I cared about the cost of that because I was like, in the grand scheme of things, that's probably where I'd most likely go if I was sick because I don't have a primary doctor here.
Yeah.
And so I wanted that copay to be cheap, and I didn't want a plan that said you have to pay for it all out of pocket until you hit some kind of high deductible.
Yeah, I mean, that's great advice for regardless of how you get your insurance is like find a plan that works for your situation. What are some of the other benefits of taking your company's insurance?
Okay, so one of my favorite lesser known benefits is when you take company insurance and the assignment stops, suddenly you are out of work. The fear there is that you don't have insurance anymore. But what we do have is the opportunity to get COBRA. COBRA, first thing people think of almost like universally is COBRA is expensive and it's not good health insurance. But what is cool about it is it's not bad insurance. It is literally the exact same insurance that you had at your company before that. So if you had signed up for not good insurance, it's the exact same.
Yeah.
If you signed up for a good plan, it carries on. It's the exact same plan. Now, the reason that it feels expensive is because you're suddenly paying for 100% of the plan, not just the portion that you were paying and the staffing agency was paying the other portion. You pay all of it plus 1%. They do charge a 1% fee. So it feels expensive, but it's really just the cost of a whole plan, whatever plan you signed up for. But the good part is this. COBRA is retroactive. So let's say you stop an assignment, you will have 60 days. And this is the research as of right now, looking it up on the COBRA site. Please do your own research and don't just go off this podcast if you're counting on this. But this is what the COBRA website said when we looked up earlier. There is 60 days that you can pretty much have COBRA in your back pocket without paying for it. Meaning, let's say something happened and you ended up in the hospital and you realized, oh my gosh, I need my insurance. I wish I had it. You can sign up for COBRA after you're already in the hospital as long as you're still in that 60 days.
Cool.
And then you'll pay for it and it'll be retroactive. It'll start back when the gap started. But then if nothing ever happened, you never had to have signed up for it. And so you essentially have this like insurance where each 60 days in between each assignment, when you have a change of life situation, which is you end an assignment, you're now unemployed, then you get issued the option for COBRA and you have 60 days to decide to take it. So it's a free benefit to us to know if we need it, we can sign up for it when we need it. And if we never need it, we never had to pay anything.
That's awesome.
So as long as your gap is 2 months or less.
Yeah.
Last thing to keep in mind with that, though, is different staffing agencies start insurance on different days. So some staffing agencies will start on the first day of your assignment. That's the best case scenario. Some will start the first of the month after you start your assignment. And some will even start the first of the month after you've worked 30 days. So it could be like well into halfway of your assignment before you're even kicking into insurance. And so those are the scariest because then it depends how big your gap was if you're still in those 60 days. We did some staffing for outpatient PT and we had insurance that we offered the travelers. You don't really know it till you're actually doing it, but our start dates as travelers change all the time. And so you have to tell the insurance company, this person is starting on this date. Sometimes they change the start date like the day before because then a license didn't come in. So their start date is technically like whenever their license comes in and they start. And we had one traveler that like the start date was pushed out, the start date was pushed out, the start date was pushed out. And insurance still started them. So we had to start paying for this insurance.
Before the person's ever worked.
Yes. And the insurance company was like, hey, you can start them whenever you want. It's totally flexible. But the fine print was, even if we started them on the 29th of a month, we had to pay for that whole month before.
Crazy.
Not just prorated 2 days. So now we're paying this huge extra amount that the traveler doesn't see. And then this traveler ended up never, ever starting. She just took another job somewhere else and never worked. So we paid for like 2 months insurance, which is very expensive. Yeah. So I think there is risk on the agency side that we don't really think about or see.
Yeah.
That, when we started staffing, we're like, oh my God, this sucks.
Yeah.
And the insurance company would be like, we'll start them the first of the month, make them show that they're going to start work before they do it. And I'm like, okay, I get it. Like it costs a lot when someone doesn't end up showing up.
Yeah.
Yeah. So anyway, there are behind the scenes reasons that would have never crossed my mind.
Wow. All right. So now let's talk about the other side of the spectrum, private insurance,
Yeah.
essentially, right? Buying insurance on your own. And there's a couple big ways that you can do that, right? And we'll talk about the most common ways, right? Where you could either go to marketplace.gov, which is like a big marketplace where you can buy insurance, or you can go through a independent insurance broker, advisor, whatever the term, someone who sells insurance on their own. Maybe you want to talk about some of the pros and cons of those.
Yeah, well, that one ended up being my favorite as a traveler personally. It is...
Which one, by the way, the marketplace or going independent?
No, independent.
Yeah.
I went through a broker. I got an insurance plan that what was important to me is what urgent care cost, and it was a $50 copay anywhere in the whole entire country.
Yeah.
So I knew, okay, it can follow me around for the most common thing that I'll have. So I ended up loving it because I knew that one thing that I cared about the most, someone who didn't have a lot of medical needs, that was secure. And then the oh my God. And then the deduct, I can't say it, the deductible.
Yeah.
Yeah. And then the deductible.
We should keep it in.
Wait, can you say it?
Deductible.
No, the deductible.
The deductible.
Say, and then the deductible.
And then the deductible.
It's harder. Try it.
And then the deductible.
Okay, you did it good.
All right.
All right.
You want to mouth it while someone else says it?
Yeah.
And then the deductible.
Then the good news is the deductible will carry over. So if you started paying on it, you can continue to do it throughout the year.
Yeah.
Versus staffing agencies, if you switch staffing agencies, your deductible starts over.
You lose all the...
Anything you paid, gone.
Yeah.
So with the finding your own, what I like the most about it is the flexibility. I was a traveler who would work a couple assignments and then literally go live in Bali for 2 months. So
Yeah.
I needed more gap time than even Cobra would have given me. So I would travel overseas and I would get overseas health insurance while I was overseas, which is travel health insurance. That coverage is amazing. It's like better than ours in the United States. And it's really cheap. So I would have my own travel insurance on top of my, United States insurance too. But I, because I was such a flexible traveler, work a little bit, probably take at least as much time off as I was working.
Yeah.
Having my own personal insurance was for sure the way to go. So I think it's better for predictability, what's going to be covered. It's better for simplicity. You have health insurance, you just pay on it, and then you have health insurance for the whole year. You don't have to worry about Cobra paperwork or did the Cobra rules change or what's my insurance going to be,
Yeah.
in a few months. I have to find a job or my gap will run out. You don't have to worry about any of that. And I found it not as expensive as I expected, which doesn't mean it's cheap. But I think the rule of thumb that they gave me is whatever your age is, you can add a 0 to that. And that is more or less how much it will cost you per month because it matters. Your age matters. For
There's a bunch of
insurance.
contributing factors to what you're...
Of course there is. But that's like the roundabout. And that ended up being true for me.
The
mine
flexibility is what I've seen, at least with our travelers, one of the biggest selling points of taking private insurance.
When you switch agencies, you will typically make quite a bit more money throughout the year than if you just stay with one because you have the ability to hear about other jobs in a region. You have the ability to compare pay packages for the same job and pick which agency you're going to go with for that assignment. And so with that, you will probably make more money by doing it that way. And then it might, come out because you have your own insurance and you can switch around and stuff, come out on top. Where if you did the math of like just staying with one agency, one insurance, even though they're paying for a piece of it, you could ultimately make more money if you're just looking at how much you made throughout the year. If you switch around and just have that insurance.
100%.
And then I think the last thing I'll say about this question is kind of the how-to. So how to get insurance with your staffing agency. They'll provide you with the options before you start. They'll provide you with, it's pretty much just a form. You pick the one you want and you sign off on it and it starts whenever their program starts. And then for private, you have those two different options. The marketplace you can get on your own or through a broker. It doesn't cost you more either way. The broker or agent will walk you through the plans and you pick the one you want, or you can go on the website. The cost will be the same. Those, when I looked at those I think are okay if you're staying in one state for a long time because they don't have, unless that's changed very recently, they did not have good nationwide plans or maybe none, so then you would have to keep switching insurance for this state and then this state and then this state. And so I didn't think the marketplace was ideal for our lifestyle.
Yeah.
And then the agents or brokers, whatever you call them, they also had the private insurance, which you're talking about. So private, I guess, could be either the marketplace or like private insurance. I don't know what else you call that. And those are plans that you can just sign up for as an individual that are not on the marketplace. So typically the marketplace is best if you're staying in one state for a long time. Otherwise, I would probably veer towards the private insurance.
Great question. Super common one. And I'm glad we can get the answer on the podcast.
Thank you, Anonymous.
Thank you, Anonymous.
Love you, Anonymous.
Thank you for joining us on episode 4 of the Nomadicare Show. If you've made it this far, let's have some fun. If you're on YouTube, below in the comments, write down if you are a pickle or no pickle person for the Chick-fil-A sandwiches.
No pickle.
I'm definitely a pickle, so I would write pickle.
No pickle.
No pickle.
Yeah.
Yeah, but barbecue sauce.
Oh, boy.
Chick-fil-A sauce.
Oh, okay.
Are you sauce?
No sauce.
Oh, yeah, spicy sriracha or whatever that one is. Yeah.
Okay. If you're listening to this on podcast, please follow us. And on YouTube, subscribe and give us a thumbs up so we know that you liked this episodes. And if you do want to be connected with the people that we love for guiding through insurance, again, that's nomadicare.com/insurance. And we will see you on the next episode.
Bye-bye.
Music bed.
Nice to meet you, hello. Never been here before, but I feel like I'm home. Yeah, 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 yeah. Put my feet on the road, meet me over the coast. We got places to